What about the war, and what about oil companies? Well, the facts of the case are we're talking about Medicare here today, a system that is draining this country from not only its ability to provide outstanding and excellent health care, but also a system that takes away choices from seniors. I thank the gentleman.
Gentleman's time has expired. Members are reminded not to walk in the well when other members have been recognized. Gentleman from Ohio.
Madam Chair, I move to strike the last word.
Gentleman from Ohio is recognized for 5 minutes.
Madam Chair, I rise in opposition to the underlying bill, and I think it's important for us to go back, as we hear about market-based solutions, to why Medicare was started in the first place. There is no market to provide health care for older people, because there's no money to be made. Insurance companies can't make money off of covering old people who get sick, really, really sick. And what this plan does, Madam Chair, and the analysis was, well, it's just going to be like the federal employee plan. We get, members of Congress and federal employees get a premium support. Well, the premium support that federal employees get is about 70-some% of the health care costs. And that number goes up and down with inflation for health care. So no matter what the health care costs are, the federal employee has 70-some% of that covered. The problem with the Republican plan is that the voucher or the premium support is hooked to the CPI, the Consumer Price Index, which is 2.5% maybe. So the voucher is going to go up at CPI, say 2.5%, while health care costs are usually 1% or 2% above GDP growth. So say we have 4% growth, then health care costs are going to go up at 5%, maybe 6%. So your premium support or your voucher is going to increase every year by 2.5%, while health care costs are going up at 5.5%. It doesn't take rocket science to figure out that over the course of several years, that voucher becomes worthless. And it will only probably cover 30% maybe of the cost of the health care that these seniors are going to get. So let's not sit here and pretend like the senior citizens in the Medicare program are going to somehow be living large and getting some kind of great health care. This dismantles the Medicare program, period, dot. And at least have the courage to come out and say we want to dismantle the Medicare program. And if you want to look at how far to the right that the Republican Party has gotten on this issue, I've never seen former Speaker Gingrich do a faster or more complete Potomac two-step in my entire life than when he even insinuated that this may not be good for seniors. Because the goal now of the Republican Party, Madam Chair, is to dismantle the Medicare program. And they tried years ago to try to privatize Social Security. This is no surprise. And so my question is, Madam Chair, if you're a 55-year-old guy in Youngstown, Ohio, who statistically over the last 30 years, your wages have been stagnant with no increase in wages, in real wages over the last 30 years, now you're saying to them they've got to come up with another $182,000 to be able to pay for their health care. Yeah, you could nod your head no all you want, Madam Chair. These are the facts. Congressional Budget Office says, neutral third party, that the average person going into this Medicare proposal will pay $6,000 more a year. That's not the Democratic Study Committee or our policy wonk saying it. It's CBO, $6,000 more a year. Well, the guy's wages have been stagnant for the last 30 years, and that's where the issue of the oil companies does come in, because we're giving huge breaks to oil companies. We'll take more arrows to protect, and on the other side, to protect even thinking about possibly asking the wealthiest 1% to pay just a little bit more to help us address this issue. The world's falling. The sky is falling. The world's ending. And it's so bad that we can't even muster up the courage to ask Bill Gates and Warren Buffett to just help us out just a little bit while we have all these problems and 3 wars going on at the same time? I mean, come on, Madam Chair. This is not right. This is not right. So, at the end of the day, the Democratic plan is for Medicare. We keep it to cover senior citizens and their health care when they get older. And if we've got to make adjustments, we make adjustments. But you don't dismantle the entire plan. You don't at the same time give tax breaks to the oil companies. Don't dismantle Medicare, Madam Chair. Don't do it.
Gentleman's time has expired. Gentleman from Texas.
Madam Chairman, I move to strike the last word.
Gentleman from Texas is recognized for 5 minutes.
I thank the Chair for the recognition. You know, if we're going to tell stories here, let's start out with once upon a time, and maybe we can end with, and they lived happily ever after. Whose budgetary plan puts Medicare at the most risk? Is it the responsible Republican plan that was debated on this floor for hours over a month ago? This was a plan, for the first time, we had laid out for us a roadmap, a pathway for how to save Medicare for people who are going to enter the program in 20 years, 30 years' time. Now, what is the plan on the other side? Well, there was no plan from House Democrats. There is no plan from the Senate Democrats. There is a plan from the President. The President laid out his aspirational budget just as the Republicans laid out their aspirational program, which was their budget. And the President's aspirational document laid out a very clear path. The President believes in 15 people, not elected by anyone, but appointed by him, and their ability to control cost in the Medicare system. It was written into a bill called the Patient Protection Affordable Care Act. You may remember it. Now, I have a great deal of sympathy with those on the other side who do not like the Independent Payment Advisory Board. In fact, one of their number wrote an editorial for USA Today yesterday decrying the nature of the Independent Payment Advisory Board. But the sad fact of the matter is, this is the Democratic alternative to the Republican plan to save Medicare into the next 50 years. That plan, the Democrats' plan, the President's plan, with the Independent Payment Advisory Board says 15 people are going to be picked. They will be paid well. They will then decide where are the cuts going to occur in Medicare. Now, true enough, Congress gets an opportunity. This 15-member board will come back to the United States Congress and say, here is the menu of cuts that we believe are necessary to have this year in order to keep Medicare solvent. By law, they have to come up with a certain dollar number of cuts, but as the President himself said in his speech to Georgetown here earlier this year, that's a floor, not a ceiling. If we need to save more money, we can go back to the Independent Payment Advisory Board and save more money. Now, Congress looks at the cuts that are brought to them by this unelected independent board and says, we don't like those cuts. Some of those cuts are going to be very damaging to poor seniors on Medicare. Do we have a choice? Yes. We can vote it up or down. If we vote it down, we have to come up with our own menu of cuts to then deliver to the Secretary of Health and Human Services. What if Congress can't agree? I know, when has that ever happened before? But what if we can't agree amongst ourselves? Do we get to do something like the doc fix that we do every year? No, we do not. That's the whole purpose of the Independent Payment Advisory Board. We cannot intervene on behalf of America's patients because the President's board has spoken. So Congress can't agree on what these cuts should be. So what do? We continue to fight. But guess what happens? April 15th of the next year, the Secretary of Health and Human Services, whoever he or she may be at that time, gets to institute those cuts that were brought to you by the Independent Payment Advisory Board. Now, is that a good idea? And I've heard discussion here on the floor today about $6,000. You know what? If you don't fix that sustainable growth rate formula, guess what's going to happen to every senior, rich and poor, who is on the Medicare program? Either they're not going to be able to find a doctor to care for them when they require care, or they're going to have to pay more money. How much money are they likely to pay? About $6,000 per senior. But look, the Independent Payment Advisory Board, Something like that has never happened in this country. In a free society, we've got now an unelected board who is going to tell us what kind of medical care we can get, when we can get it, where we can get it, and most importantly, when you've had enough. And when they say you've had enough, that's it, no more. Dialysis, insulin, doesn't matter, you're full, you've had your share. That is the problem with the Independent Payment Advisory Board, and Congress then becomes powerless because frequently we do disagree with each other. If we can't come to a consensus, the Secretary makes that decision for us, and then the next year the process starts all over again. Again, I've got a great deal of sympathy with my friends on the other side of the aisle because they did not include this language in their bill, and we all remember a year ago the very bad process that brought us the Patient Protection Affordable Care Act. And what was that process? It was the Senate on Christmas Eve that passed a House-passed bill that then came back over to the United States House, and will the House now agree with the Senate amendment to H.R. 3590? You all remember 3590? It was a housing bill when you passed it in the summer of 2009. It was a health care bill when it came back to the House. You did not include the Independent Payment Advisory Board in H.R. 3200 for a very good reason. The reason is it's un-American, and you know it, but now you're left to defend it. I yield back the balance of my time.
Gentleman from Massachusetts. Gentleman is recognized for 5 minutes.
Thank you. You know, this is a crazy debate that we're having here right now, because you know, the Republicans, they keep saying to the Democrats, well, what's the plan? And so we say to the Republicans, well, what's your plan? Your plan just seems to be saying to Grandma and Grandpa that they're taking too much, that they're taking America for a ride, and we have to cut Medicare. Their health care is too good. And Grandma and Grandpa, they didn't do enough for America. And so the Democrats, we turn around and we say, hey, how about looking at it this way? How about before you go after Grandma and her Medicare card, how about you say to Warren Buffett, hey, how about not taking those extra tax breaks to Warren Buffett? And the Republicans say, oh, we can't take away any tax breaks from Warren Buffett and all the other multi-millionaire and billionaires because they've contributed so much to America. We don't want to touch their money, even though that would give us hundreds of billions of dollars. And then we say to them, well, how about prescription drugs? How about we negotiate the price for prescription drugs for Medicare the way we do with the VA? That would save about $250 billion over a 10-year period. They say, oh, that would be unfair to the drug companies. We can't touch them either. Then we say to them, well, you know, the war in Iraq, the war in Afghanistan, it's winding down now. Maybe we can look at the defense budget and save a few $1 billion there before we ask Grandma to sacrifice on the health care that she gets from Medicare. And the Republicans say, oh, we can't do that either. We can't look at any cuts in the defense budget. That would be much too hard for on those defense contractors. And so then we say to them, well, how about the oil industry? At least the oil industry, the $40 billion in tax breaks, which they're going to get over the next 10 years. I mean, does anyone in America really believe that they need tax breaks in order to have an incentive to go out and drill for oil when people are paying $3.50, $4 a gallon at the pump? But the Republicans say, no, you can't touch the oil companies either. You've got to give big tax breaks to the oil industry as well, even as they're tipping Grandma and Grandpa upside down at the pump when they're coming in to put in their unleaded $4 a gallon gasoline, self-serve, by the way, for Grandma and Grandpa at the pump. So what do they do instead? What they do is they put an oil rig on top of the Medicare card so that the oil industry can drill into Grandma's Medicare and pull out the funding in order to provide the tax breaks for big oil, for Warren Buffett, for the prescription drug industry, for the war in Iraq and Iran. It's all off of Grandma. She's the one. We've targeted the person responsible for all of the wasteful spending in the United States. It's all Grandma's fault. Let's cut Medicare. She didn't do enough to build our country through the 30s, the 40s, the 50s, and the 60s. It's all on Grandma. So this drill rig that they are building into the pocketbooks of Grandma in order to find that funding, That's what their plan is all about. It's an oil pipeline into the pocketbooks of the seniors. They want to cut checkups for Grandma. Well, they cut checks for the oil companies. They want to cut health care to Grandma and give wealth care to big oil companies and to billionaires and to prescription drug companies. Their plan is big tax breaks for big oil and tough breaks for Grandma and for the seniors in our country. And the CEO of Chevron, he says it's un-American to think about increasing taxes on the oil industry. Well, you want to know what I say to him? It's unbelievable that you could make that argument, but even more unbelievable that the Republican Party would accept that argument and cut Medicare for Grandma, to privatize it, to hand it over to the insurance industry, to increase the cost by $6,000 per year for their costs, even as they say to Warren Buffett, the oil companies, the big drug companies, the arms contractors, don't worry, we're going to protect your programs. It's just Grandma that's on the cutting block. So, ladies and gentlemen, this is a debate of historical dimensions. And until the Republicans come forward with a plan, which they don't have, in order to make Medicare solvent, by raising the revenues out of these other areas from millionaires, from the oil industry and from others, do not expect us to say to Grandma, it's your fault. It's not her fault. She built this country. She deserves this benefit, and we should not be cutting it. This Republican plan to end Medicare is just something that wants to turn it over to the insurance industry. Vote no on the Republican plan.
New York. Gentleman from New York. Oh, gentleman from Connecticut.
I move to strike the last word.
Gentleman from Connecticut is recognized for 5 minutes.
And I rise in opposition to the underlying bill, which, by the way, is a bill that would repeal a provision of the Affordable Care Act that was aimed at trying to strengthen the primary care infrastructure of this country, which is, in fact, a huge challenge for the Medicare program. But for some reason, over the last couple of months or so, Medicare just seems to be the target. I think it's important for people to remember that in 1965, when Medicare was passed and signed into law on Harry Truman's front porch, only half of America's seniors had health insurance. Part of it was because of the cost, but part of it because the insurance companies would not insure that demographic. It was just simply too high a risk to write insurance policies by individual companies for people who, again, because of nature, carried the highest degree of risk in terms of illness and disease. Over time, the genius of Medicare, which was to pool risk, to create a guaranteed benefit, to fund it through payroll taxes, to fund it through Medicare Part B premiums, demonstrated that we could raise the dignity and quality of life for people over age 65 and, in fact, extend life expectancy. But the Republican Party has been targeting this program over and over again. In the 1990s, they came out with Medicare Part C, Medicare Plus Choice, which was, again, giving insurance companies a set payment who promised to provide a more efficient, lower-cost product for seniors. And what happened? Insurance companies enrolled millions of seniors in Medicare Plus Choice products, and realizing in a short space of time that they did not, in fact, have the funds to create a sustainable product, they canceled coverage for seniors all across the country. I was at hearings in Norwich, Connecticut in 1998 where seniors who had signed up for these programs suddenly got notification in mid-policy year that the insurance companies changed their minds and they dropped them like a hot potato. In many instances, for seniors who were in the middle of cancer treatments and chronic disease treatments, were left high and dry without coverage. So that program failed. Later, we had Medicare Advantage. Medicare Advantage was sold on, again, the premise that it would provide coverage for seniors cheaper than regular Medicare. And what, in fact, happened? The Department of Health and Human Services had to offer insurance companies 120% of the baseline cost for Medicare in order to entice insurance companies to participate in the Medicare Advantage program. A ridiculous overpayment treating unfairly seniors who are in traditional Medicare and paying for Medicare supplemental insurance. Last year, we did something about that unfairness by equalizing the payments to seniors on traditional Medicare and Medicare Advantage. And today, what we currently have is the Ryan Republican plan, which says you get an $8,000 voucher if you're under age 55, and good luck in terms of trying to find coverage, again, in a market that is going to be very careful about not extending actual coverage because of the risk that's attached to it. Now, the rank unfairness of saying that we're going to create a two-tiered system for people over the age of 55 and people under the age of 55 is obvious even in my own family. I'm 58 years old. My wife, Audrey, who's a pediatric nurse practitioner, is 51. I get one version of Medicare. She gets stuck with the loser version of Medicare under this proposal. Again, the unfairness of it is so obvious to all families across America, and again, it's one that is why I think the public is turning so quickly against the Republican agenda. And we are told and we are asked, what's your alternative? Well, look at the trustees' report that came out last week. Look at it. What it said was that the Affordable Care Act, in fact, extended solvency for the Medicare program by 8 years. We did suffer from some reductions, but that was because of the economy. Read the trustees' language. The smart efficiencies which were introduced into the Medicare program through the Affordable Care Act, in fact, have made the Medicare program healthier. And if you look at the Ryan Republican budget plan, they took every nickel of those savings from the Affordable Care Act, even though that caucus demagogued all across the country campaigning about so-called Medicare cuts in the Affordable Care Act. Well, the Ryan Republican plan incorporated every single one of those changes in the Affordable Care Act, but at the same time, it took away all the benefits of the Affordable Care Act in terms of helping seniors with prescription drug coverage, annual checkups, cancer screening, smoking cessation, all of the smart changes which the Affordable Care Act made to provide a better, smarter, more efficient Medicare benefit for seniors. The fact of the matter is that the Democrats do have an alternative. We have a program which we passed last year, which for the first time in decades extended the solvency of the Medicare program. Let's not abandon it. Let's preserve the guaranteed benefit for seniors. Let's reject the Ryan Republican Medicare plan.
Time has expired. Gentleman from Washington. Gentleman from Washington. Gentleman's recognized for 5 minutes.
Madam Chairman, I rise in opposition to this underlying bill. It reminds me, as I listen to this debate, of debates around the Vietnam War. I remember a village that was napalmed by a military unit, and the officer who had him do it said, he was asked why he did it. He said, well, I destroyed it to save it. Now, that's the argument we're hearing today on Medicare. We have to destroy it to save it. Now, ask yourself, and there are a lot of people watching, Madam Speaker, if I were sitting at home trying to figure out what's this all about, well, why would Representative Ryan suggest that a voucher system is the way to save Medicare? Because of the rising costs. Everyone knows that the cost of Medicare and medication and health care in this country is totally out of control. Now, President Obama came up with a plan, which he brought out here. It wasn't like he created something that nobody had ever thought about before in the whole United States. He looked at the state of Massachusetts. It's been a place where a lot of great things have come from. And he saw what Governor Romney, a Republican thought that we ought to have a universal plan for Massachusetts. And so they passed the law, and they covered everybody in Massachusetts. Now, then came the question, once you've got access for everybody, how do you control the costs? Well, then the problems developed. And the problem was, they found in Massachusetts, they didn't have enough primary care physicians. Now, what does that have to do with it? That's what this bill is about. This bill is about the training of primary care physicians. What everybody in this country needs is a physician that knows them and is a medical home. When they get sick, they go to that person. The doctor knows them. If they need some preventive care, The doctor takes care of it. The doctor does it in a very cost-efficient way before the catastrophes. Now, for the many people in this country who don't have a primary care physician, they sit at home and say, well, I got to wait till I'm really, really sick. And then they go to the emergency room. Now, if you have your blood pressure monitored and you take medication, you can live a long life. But if you don't, you are very likely to wind up with a stroke. Now, we spend millions of dollars in hospitals on stroke victims that could have been prevented by good primary care. And we say to ourselves, well, why don't we have more primary care physicians? Well, because the healthcare system is designed to take care of people after the big event. After they've got the cancer, we'll spend millions of dollars on cancer treatment. We'll spend millions of dollars on heart problems, on all these things where prevention could have prevented it all and cost less. That's what every industrialized country in the world has done. It's why the Swiss are able to provide universal coverage to everybody in Switzerland for a little over 1/2 of what we spend in the United States, because they provide good preventive care in the form of general practice, general medicine. That's true in England, in Norway, in Canada, in every other country except the United States, where we are dominated by specialists. Now, in this country, if you get sick or you have a pain, if you don't have a primary care physician, a doctor who knows you, you call up your friends and you say, I got a pain in my leg, what should I do? And they say, well, I saw an orthopedic surgeon and his name is such. And so you go to a specialist. And that specialist looks at your leg. He doesn't look at all the rest of it. He doesn't know what's going on with you. He doesn't know your whole history. When I started in medical school, the maxim we were taught from the very beginning was, listen to the patient. He's telling you what's the matter with him. And everybody knows that doctors are running on a conveyor belt today, one right after another, no time to listen, because we have not invested in primary care physicians. Now, the average kid going to medical school would like to take care of people, but when he comes out, or she comes out, they are $250,000 in debt. This bill is making that problem worse, and therefore is bad for grandma and everybody else.
Gentleman's time has expired. Gentleman from Georgia.
Move to strike the last word.
Gentleman's recognized for 5 minutes.
I thank you, Madam Chairman. Sitting in my office listening to this debate and can't help but feel that this is nothing but a bunch of demagoguery on the part of our colleagues on the Democratic side of the aisle. I take this opportunity to oppose the amendment, but more importantly, to ask my colleagues to stop this demagoguery in regard to throwing grandma under the bus in reference to the Medicare program and what our side of the aisle has proposed in the Republican budget. You know, the average age of this body is 58 years old. Almost all of us are grandma and grandpa, and you're running these ads all across the nation, I guess particularly in New York 26, showing a reasonable facsimile of our fantastic chairman of the Budget Committee pushing grandma in a wheelchair off the cliff. Look, New York 26 is over. You don't need any more votes. Stop all this demagoguery. You've done nothing in regard to the Medicare program. What is there in the 2012 budget, in the Obama budget, that does anything toward trying to solve the Medicare program, which will be bankrupt in 2024 if nothing is done? That is the total irresponsibility and the hypocrisy of this side of the aisle, Madam Chairman. And the responsible side of the aisle is the Republican side of the aisle, which says, look, let's save this program for our children and our grandchildren, guarantee, protect, and strengthen it for Grandma and Grandpa, our current seniors, and not only the current seniors who are 65 and those who are disabled and already on the Medicare program, but anybody who will come into the Medicare program within the next 10 years. And, you know, Madam Chairman, at that point, in 2022, you'll have about 65 million people on the Medicare program as we know it, traditional Medicare, and they will be on that program until their natural death. And many of them, thank God, because of our great health care system in this country, will live to be 90 years old. So this idea of killing Medicare is an absolute misinterpretation, and you know it. You're misleading the American people. This program that we are proposing, and it's a proposal, it's something that we can work together on both sides of the aisle. We can negotiate. You know, it's not set in stone, but what we say, what Speaker Boehner says, what Chairman Ryan says is, look, let's try this program in 2022 where people who are coming into Medicare at age 65, many of whom are working and in excellent health, we will simply give them a premium support, but not a voucher in their hands, but to send to the insurance company of their choice. Let them get their medical care where members of Congress get their medical care. Let them have the same options to choose from, Madam Chairman. That's what this is about. And the average, if it's $8,000, it will be adjusted every year for inflation. And that average $8,000 will be higher for an individual who comes into the Medicare program at age 65 that's already sick, that already has heart disease or diabetes or is on dialysis. It's somebody, as they get older, that premium support will increase. This is the way we save the Medicare program. And, oh, yes, by the way, folks like us, like members of Congress, our premium support will be significantly less because we're not Warren Buffett, but we can afford to pay more, and we should pay more. If that's $4,000 a year more, so be it. We saved the program for those who need it the most, those who are middle and low-income seniors, and that is the compassionate thing to do. So, colleagues, stop this demagoguery. Let's get together, let's work together and solve this problem once and for all. And I yield back.
Gentleman yields back. Members are reminded to address their comments to the chair. Gentlewoman from Illinois. Yes, I move to strike the last hour. Gentlewoman from Illinois is recognized for 5 minutes.
Oh, I'm getting a real kick out of this debate. I really am. You know, we hear one after another, my Republican colleagues coming up here and self-righteously talking about ending the demagoguery and we should end the TV ads. And I just want to remind you that through the 2010 elections, the Republicans went on television and, yes, how about demagogued the issue of Medicare, saying that Democrats wanted to cut $500 billion from Medicare. Well, let's talk about the truth. We were challenged just a little while ago, what is your plan? Well, here was our plan to save Medicare, and that was to say in the Affordable Care Act, yes, we're going to cut subsidies to the insurance companies. That meant that we're bilking the government and the taxpayers, and we were having to overpay them. And yes, we're going to cut waste and fraud from the Medicare program, and that's how we're going to save $500 billion. But not only would we not cut a single penny from benefits, but we were actually able to increase benefits while trimming Medicare. We, so you scared the heck out of seniors, but never mentioned, of course, that at the same time we reduced the cost of Medicare. We improved Medicare by adding to its solvency. We closed the donut hole, making prescription drugs more affordable, and we provided a wellness exam every year at no cost, and we provided preventive services with no cost sharing. But nevertheless, on television, those ads warning against those Democrats who didn't cut one thing from Medicare and improved it. And now you're saying, well, we're not going to do anything to people 55 and under. To me, that sounds like 55 and under, you better look out. Now, the ads in New York are working because people love their Medicare. And what they don't want to see, all but 4 Republicans voted to literally end Medicare. You can call it something else, but you can't call it Medicare because those guaranteed benefits are gone. It makes huge cuts in Medicare benefits. Seniors that fall under the new plan would have to pay about $6,000 more a year. That's what the Congressional Budget Office says. $6,000 more a year out of pocket for their health care. And it would put insurance company bureaucrats in charge of seniors' health care, letting insurers decide what tests and what treatments that seniors get, throwing seniors back into the arms of the insurance companies who have shown no love to them. And so let's look at what the American people think about Medicare. Well, if you're 65 years and older, 93% of Americans say the Medicare program, as it is right now, is very important or somewhat important to them. Actually, 83% very important. If they're 55 to 64, 91% say Medicare is very important. That's 74%. Or somewhat important. And if you're 40 to 54, we've got 79% of Americans who say the Medicare program is very or somewhat important. And if you're 18 to 39, 75%. People get it. Medicare works. Medicare is efficient. Medicare is good for our country, for people with disabilities and for the seniors. And if we're looking to save Medicare, we do have a plan. We know how to make that more efficient. We have done it in the Affordable Care Act, and we are willing to sit down and talk about how we make Medicare more efficient, but not by ruining and destroying and getting rid of Medicare to the point that you got to find another name. It won't be Medicare anymore. And so they've admitted, it seems to me, that people 55 and younger, you better look out, because that program that will allow our seniors to live perhaps to 90 years old, people who are going to be eligible for Medicare as it is right now, will no longer be in place. And we're not talking about rich people.
Gentlewoman's time has expired.
We're talking about poor seniors, middle-class people. Don't support this plan.
Gentlewoman's time has expired. Members are reminded to refrain from trafficking the well while another member is under recognition. Gentleman from Georgia. Gentleman from Georgia is recognized for 5 minutes.
Thank you, Madam Chair. Like my colleague from Georgia, I too was sitting back in my office. I saw the debate break out on the floor of the House on the Medicare proposal, the proposal to rescue Medicare from certain bankruptcy. And I wonder, because I sit on the Rules Committee, and the Rules Committee has one of the great pleasures of deciding what comes to the floor and how it comes to the floor and what goes on. And I knew that this wasn't Medicare Reform Day. This was the amendment by my colleague from North Carolina, Ms. Fox, to protect life. It was an amendment to a bill brought to the floor by my colleague, Mr. Guthrie, which restores congressional oversight and regular order through the appropriations process, those things that I ran for Congress to do. And I rise in strong support both of the Fox amendment and of Mr. Guthrie's underlying bill. But when I hear this talk about Medicare and all the games and what has happened in the past, I have to say I've only been here, this is what, month number 5 for me. I'm still brand new, and I'm still optimistic enough to believe that it doesn't have to all be about sound bites, that it really can be about solutions. And I want to say to my colleagues on the Democratic side of the aisle, when you say that you came up with a proposal in the President's health care bill last year to deal with Medicare, I believe you. I take you at your word. I read through that, too. I saw that Medicare Advantage was removed as an option for seniors. That distressed me. I saw that new benefits, as Ms. Castor just referenced, had been added, Madam Chair, added to a program that's already going bankrupt. I saw that that is one direction that you can take the Medicare program. Now, I'm a proud member of the House Budget Committee, the House Budget Committee that worked hard and long to produce the Medicare reform proposal that we're talking about, oddly enough, here today. And it's a program that saves Medicare for everybody 55 years of age and under and provides them with choice. I just want to tell a personal story. You know, I don't consume a lot of health care. I've been very blessed in that regard, but I had to go in for a chest CT the other day. I have a medical savings account, so I'm responsible for the first couple of $1,000s of my health care bill. So first health care I've consumed was my chest CT. Got on the internet and started shopping around. Turns out the difference between the cheapest chest CT and the most expensive chest CT in my part of Georgia, 4 times. 4 times. I got in the car, I drove across town, spent my $4 a gallon for gas to go get the cheap one. Turns out the really expensive one was right next door. Could have just walked right next door. Folks, when we talk about how we, the United States Congress, we, the U.S. House of Representatives, voted to save Medicare in the 2012 budget proposal, we talked about saving it by providing choice. Again, my colleagues are exactly right. We did that in 1997. That was the debate. Can we save Medicare in 1997 by providing more choice? Well, we succeeded with adding Medicare Advantage, but we didn't get much further than that. This is that next step. This is that next step because we know that choice matters. We know that choice matters. The gentleman who held my seat and then retired used to tell the story of his mother in upstate Minnesota. And every Tuesday she'd go to the doctor with a group of friends just to make sure everything was okay, just to get checked out. She was on Medicare. One day it was a terrible snowstorm in Minnesota. Winds were blowing, snow was piling up. They all got together on Tuesday, and Edna wasn't there. And they began to get worried. They called around, they asked around. Turned out, Edna just wasn't feeling well. She couldn't be there that day. You make different choices when you're not responsible for the bills. And we do that over and over and over again. This isn't just a Medicare issue. This is a philosophical difference between these two sides of the aisle about what kind of America we are going to live in going forward. Are we going to live in one where folks take care of you, but they tell you the manner they're going to do it? Or are we going to live in one where we help you along, but you get to make those fundamental choices for you? It's clear to me why my constituents sent me to Washington as a first-time elected official this year. It's clear to me where the 2012 budget proposal takes this House and takes this country. I implore my colleagues, we can absolutely argue about your plan as it was introduced in the President's health care bill and our plan as it was introduced in the FY 2012 budget proposal. But let's not make it anything other than what it is. It is a difference in two visions. Yours saves Medicare for 6 years. Ours saves Medicare for a lifetime. And, Madam Chair, I think we owe the voters no less. I yield back my time.
Gentleman yields back. Gentleman from Colorado.
I move to strike the last word.
Gentleman from Colorado is recognized for 5 minutes.
I thank the Madam Chair. And I just say to my friend from Georgia, who really is my friend, and this isn't about demagoguery, sir. And what I would say, Madam Chair, the issue before us is what got our country into a financial pickle. The Republicans want to pick on Medicare. But Americans know. I had a government in the grocery this weekend, and an older gentleman came up to me and he says, you know, why is there such a focus on Medicare, something that's been working for 50 years? You know, it's helping seniors have healthier, longer lives. What's the big deal? He said, you know, 10 years ago, this country was running a surplus. running a surplus. Revenues exceeded expenses. Under Bill Clinton, revenues were exceeding expenses. But then there's a decision under the Bush administration to cut taxes. Okay, if revenues are exceeding expenses, maybe that's okay. That cost us $1 trillion over the next 10 years. Then, decision to prosecute 2 wars. Says to me, two wars, that cost us about $1 trillion too, didn't it, Mr. Congressman? I said, yeah. Says, okay, so Medicare, 10 years ago, we're fine. Revenues exceed expenses. Now we've got tax cuts for millionaires and billionaires, $1 trillion. 2 wars, $1 trillion. And then there was this big crash on Wall Street where we lost revenues and we had bigger expenses. That was a couple $1 trillion, wasn't it, sir? I said, yeah, that's about right. He said, so why? That turned our budget upside down, so now why are we focusing on Medicare? Why blame Medicare for $4 trillion of losses to the United States? It wasn't Medicare that is harming the financial success of this country, so why all the blame when this program really has been working for seniors for so long? So I would say to my friends on the Republican side of the aisle, this is a program that my friends haven't liked since its inception. In a second, I will yield to my friend from Georgia. But this is a program that Republicans haven't liked from its inception. So to turn the target into Medicare and not say to have tax cuts for millionaires and billionaires, that should be part of the whole equation of balancing our budget, or taking away the incentives and all of the tax benefits for oil companies at $100 a barrel, but say, no, we're going to focus on Medicare. In my opinion, that's just wrong. But I'd yield to my friend from Georgia.
Colorado, my good friend, for yielding, and I would just rhetorically ask, and maybe he would want to definitively answer, how much of the windfall profit taxes, if you will, against big oil, big pharma, big anything, are you going to put back into the Medicare program? And by the way, how much of the Medicare Advantage cuts that came from Obamacare are actually going back into the Medicare program as we know it?
Taking my time back, I'd say to my friend from Georgia, you know what? If those tax benefits are taken away at $100 a barrel, we can put them into Medicare. We can use them to balance the budget. But I heard my other friend from Georgia say, well, this is what's causing the bankruptcy. That's just not true. You know, they know what got us into trouble financially. It wasn't Medicare. So now to take it out of Medicare and just, you know, take it out of our senior citizens where a program is actually working, the goal of that program was so Americans could live longer, healthier lives in their senior years. It's working. But no, let's go blame that instead of the tax cuts for millionaires and billionaires. Let's forget about those wars and the cost of the country, and let's forget about the fact we had a crash on Wall Street. Hey, this is a perfect, my friends on the Republican side of the aisle say, hey, this is a perfect time to go after Medicare. We haven't liked it before. We still don't like it. Let's get it. With that, I'd yield back.
Gentleman yields back. Pursuant to Clause 6 of Rule 18, proceedings will now resume on those.
Madam Chair, point of order.
The gentleman from New York rise.
Rise to a point of order.
Will state his
Madam
point
Chair,
of order.
under the rule, members are entitled to 5 minutes to speak to the matter at hand. Members are waiting, principally among them is myself, waiting at the microphone to be recognized for that purpose. And now it sounds like you're proceeding to shut down debate. I say that it is in violation of the order of the House as decided by the Rules Committee to permit members to speak for 5 minutes on this matter. It's early in the evening. Many members are waiting to speak.
Pursuant to Clause 6 of Rule 18, the Chair may resume proceedings on a postponed question at any time.
Madam Chair, point of parliamentary inquiry.
State his
So the
parliamentary
Chair
inquiry.
is deciding, notwithstanding the fact that a member is standing here to speak about the plan to end Medicare, not to mention members are here seeking to be recognized, I believe, of both parties. The Chair is choosing at this moment that this is the propitious moment to cut off debate early in the evening when we have plenty of work to do and members seek to speak and offer amendments? Is this the chair deciding arbitrarily, or was she given guidance to do this by the Republican leadership who don't want to hear any more critique of their plans to end Medicare?
The chair is exercising her prerogative to resume proceedings at any time.
I'll take that as a yes, Madam Chair, and I must say, on behalf of all of us here, this is a travesty in the way we do business.
The gentleman is not recognized. Pursuant to Clause 6 of Rule 18, proceedings will now resume on those amendments printed in the congressional
Madam Chair, I make a motion we do now rise.
Further
Madam Chair, I move we do now rise.
Question is on the motion to rise. All those in favor, say aye. Aye. All those opposed, no. No. The noes have it.
Roll call vote, Madam Chair. I insist upon it.
The gentleman requests a recorded vote.
Yes, he does.
A recorded vote is requested. Those in favor of taking this vote. Taking this vote by recorded vote will rise.
Okay. Madam, pending that, I make a point of order. A quorum is not present. I think you want to rule that the vote is in order.
Hey, you don't want.
Requested. Those in favor, please rise again so I can recount. Go ahead. A sufficient number having arisen, a recorded vote is ordered. Members will record their vote by electronic device. This is a 15-minute vote. Pursuant to Clause 6 of Rule 18, proceedings will resume on those amendments printed in the congressional record on which further proceedings were postponed in the following order. Amendment number 2 by Mr. Tonko of New York. Amendment number 9 by Mr. Cardoza of California. The reduced to 5 minutes, the minimum time for any electronic vote after the first vote in this series. 15-minute vote.
Well, for the last 2 hours or so, the House has been ostensibly debating a proposed amendment to an overall bill that would change the way graduate education, medical education, is funded in the U.S. The underlying amendment was that of Virginia Fox, which would have prohibited the use of funds for graduate medical education, medical school education, from being used to provide abortion or training in the provision of abortion. But that changed a couple of hours ago as the debate sort of morphed into a broader debate on Medicare, in particular some proposed changes to Medicare made by Paul Ryan, the Budget Committee chairman. What's happening now, it appears on the House floor, is a vote on whether the committee will rise, made by Representative Wiener of New York. This is a 15-minute vote, but there are several amendment votes pending to this underlying graduate medical education funding bill that the House has been debating throughout much of the afternoon. 3 pending amendments, we think. One by Representative Fox, the other by Congressman Tonko and also Congressman Cardoza, and we expect a final passage vote as well on the bill itself, too.
Again, on the House floor, ahead are a couple of amendment votes on a bill that would change how Congress funds graduate medical education. The House has spent much of the afternoon debating the bill and proposed amendments, and the last amendment they had been debating was that of Virginia Fox of North Carolina, but they spent the better part of 2 hours not only on that amendment, but the debate moved on to a broader discussion on Medicare as members of the House asked the Speaker, the Chairman, to strike the last word, which gave them an extra 5 minutes and continued the debate for some time. Well, Representative Capito of West Virginia called the vote, and Representative Weiner of New York objected and made a motion that the committee rise. That's where we are right now, this 15-minute vote. Those votes on the amendments are still ahead. A final passage is still ahead as the debate over the medical education funding has kind of hit a speed bump here in the afternoon, but we think that the House will move on after this series of votes and the final passage vote. We think they will move on to initial debate anyway on the Defense Authorization Bill, the Defense Programs and Policies Bill for the next fiscal year. And we talked to a Capitol Hill reporter about what's ahead in that debate. John Bennett of The Hill joins us. The House begins debate on the annual Defense Authorization Bill. What are some of the issues lawmakers will bring up in the debate?
We are definitely going to see a lot of discussion about the Afghanistan war, and I think the broader war on terrorism now that we're in the post-Osama bin Laden era. I've just done a quick count here, kind of back-of-the-envelope math, and I see at least 5 amendments already that are Afghanistan-related, mostly by Democrats. You've got a few Republicans signing on here, but all would either call for a significant U.S. troop withdrawal, a complete U.S. troop withdrawal, the creation of a smaller counterterrorism force, or would put limits on some of the funding for the Afghanistan war until more troops than are planned to come out this year. A plan would be set in place to bring out more troops. So the Democrats are definitely targeting the Afghanistan war. They think it's time to get out of there. It's too costly, and America got bin Laden, so they think that now is a good time to pivot and focus on some of the issues back here at home.
Another contentious issue is the F-35 engine. What sort of debate will we have in terms of amendments for or against the F-35?
We're going to see a debate that in some ways mirrors one earlier this year when the House actually, in an earlier version of 2011 spending legislation for the Pentagon, actually voted to kill the second engine program. And you'll see the same debates, that it's not needed operationally, that it just costs too much to do 2 engines right now, especially with all the other fiscal problems the nation is facing. But a twist could be added here that may keep the program from being voted down in the House. The makers of the second engine, GE and Rolls-Royce, have offered to self-fund the engine at least through fiscal 2012. So that would get you well in. That would get you to October of next year before Congress would have to make another hard decision. It's unclear, though, how that's going to affect any votes on amendments to kill that program. The bill does contain a provision written by the House Armed Services Committee whose leadership supports both engines, and that would force the Pentagon to create a competition that the Pentagon would get to create if certain enhancements were made to the primary engine. But that is considered kind of a long shot to keep the program alive. So it's unclear what's going to happen there, but you're going to see kind of a repeat of the debate from earlier this year.
What about military operations in Libya? Does the bill address this at all?
It looks like the bill will have an amendment that will be an authorization of force similar to the provision in the Senate. It's still unclear how closely it will track with the one in the Senate. But it looks like they are going to do something, and this is, it's kind of the easiest way to do a Libya operation resolution by tacking it onto the defense bill.
What has Secretary Gates said about the Defense Authorization Bill?
You know, he hasn't said a lot outside of the engine, and one of the reasons for that is...
And he's an opponent of this second engine, correct?
That's correct. He definitely doesn't want the second engine to be kept alive in any way. He thinks it's not needed and too expensive. But I think the Pentagon does like the House authorization bill. Secretary Gates has already cut a lot. The White House has ordered some Pentagon cuts, but Secretary Gates, in fact, in a speech today, has said, and he said this Sunday at Notre Dame commencement speech, that as the defense budget is cut, there's a need to guard the modernization accounts. Those are the weapons programs. And this bill that the House is considering starting today does that. It keeps all the hardware and modernization plans of the Pentagon intact. It doesn't really touch any of them. So, by and large, I think the Pentagon likes this bill.
John Bennett covering the defense debate on Capitol Hill. You can read his articles at thehill.com. Thanks for that update.
Thank you.
And it looks like the House will later on move on to some initial debate on that defense programs bill. But here's where things stand. The House had spent much of the afternoon debating a bill that would change the way that Congress funds graduate medical education. They debated a number of amendments. A number of those amendments are pending, 3 of them, as a matter of fact, pending a vote by Representative Tunko and also Representative Cardoza. They had been debating an amendment by Virginia Fox of North Carolina, and that debate sort of expanded into this broader Medicare debate that went on for a couple of hours. Representative Weiner of New York made a motion that the committee rise, and that is what we're seeing here. 15-minute vote on that. This is the first in what we expect to be a series of 3. They will deal with a couple of amendments related to that funding bill for medical education, and then move on to initial, at least general debate on the defense programs bill, and likely finish up work on both of them on Wednesday. But this is a 15-minute vote. We're going to take you next over to the U.S. Senate, which has been dealing with reauthorizing certain provisions of the Patriot Act. Senator Leahy came to the chairman of the Judiciary Committee, came to the Senate floor today and spoke about his opposition to the expansion of these provisions. His comments run about 15 minutes, and we'll show you as much as we can during this vote.
We're nearly 10 years after the attacks of September